Good evening, all, and thank you for joining us on this July steamy night. We really appreciate you being here. I wanted to take a moment and just talk a little bit about the fact that, for all of us, and you can see many of us are still working from home some of the times, but it's been quite an 18 months. Nearly 50% of adults reported feeling uncomfortable about returning to in-person interactions. And COVID lockdowns have increased social anxiety throughout all adults. There is still uncertainty, and we know that we've made it a long way throughout COVID-19, and for many of us very safely, but others not so much. And with the variants, we all need to stay very diligent, but move on with our lives and be able to start to enjoy our friends, our family, and have laughter every day again. These panelists will provide resources, answers, and advice as to how to bring back joy and purpose in our lives while transitioning back to our normal. So, without further ado, I do want to introduce our panelists this evening. First of all, we have Alisa DeLage. Alisa is a licensed clinical social worker and has been with Old Colony Elder Services for 6 years. In her role as Chief Programs Officer, Alisa oversees all consumer-facing programs and staff. Alisa holds a Bachelor of Science in Psychology from Bridgewater State University, as well as a Master of Science in Nonprofit Leadership and a Master of Social Work from Boston University College of Education and Human Development. She is a member of the National Association of Social Workers. In addition, Alisa is on the Brockton Visiting Nurse Association's Board of Directors. Alisa is passionate about supporting older adults as they age in place and assisting older adults and individuals with disabilities transitioning from hospital, rehab, or nursing home back to a community setting. Prior to her work with Old Colony Elder Services, Alisa's primary roles were with children and family as they navigated the foster care and adoption systems in Massachusetts. Alisa is now an adoptive parent of 2 young boys, which is pretty remarkable. Thank you for joining us, Alisa.
Thanks for having me.
Great. Michelle Bratti is our next panelist. Michelle is Director of Elder Affairs for the town of Plymouth since 2019, not 19, 2019, after spending 28 plus years as a therapist working with intergenerational families and children with trauma. Michelle began working for her town as a social outreach worker at the Center of Active Living in March of 2019. The director at the time left Plymouth for another position, and Michelle interviewed for the director position and was appointed in the role in June of 2019. Michelle states that this role is her dream job. Not many of us can say that. That's awesome, Michelle. And she loves what she does in her advocacy role for Plymouth seniors. The Plymouth Center of Active Living, also known as CAL, is welcoming, thriving, robust senior a robust center that boasts over 240 activities and programs, opportunities to socialize, and supportive services designed to engage mind, body, and spirit. They serve Plymouth residents at aged 59 and over and are located at 44 Nook Road in Plymouth, if you haven't been there. The same beautiful campus as the Plymouth North High School. So welcome to you, Michelle. Thank you for joining as well. And last but certainly not least is Sarah McLeod, who has more initials than I can even say, MBA, MSW, and licensed social worker, has specialized in development of innovative programs, healthcare intergeneration, and interagency partnerships, and has lectured on those topics at national conferences. In addition to serving on the board of a number of nonprofit organizations which focus on wellness and health, Sarah is the author of Mama Paka children's book series, which focuses on grief, loss, and hope for youth and families impacted by the opioid epidemic. That's pretty remarkable and such a great cause, Sarah.
Thank you.
Sarah has been the Director of Social Work at Beth Israel Deaconess Hospital, Plymouth, since 2015. So as you can see, we have a incredibly educated and experienced group of panelists, and we will get right to our questions, which we know so many of you are having, which leads me to my next slide. If you do have a question for Alisa, Michelle, or Sarah throughout this presentation, please utilize your on your desktop, your chat button, or the same thing with your mobile, if you're on your phone, you can also access the chat. Ask the question, I can see it, and I will be able to incorporate your question and ask the panelists. So please don't hesitate. I will be looking at that chat throughout the webinar. So please don't hesitate. So without further ado, we're going to get right to the questions. Again, kind of navigating our new world. The first question that we thought would be important to all of you is, how do we transition back into normal? And how do we overcome the anxiety involved that we all have experienced, whether it's going to a grocery store, going to a family event, going to the beach, going back to your exercise class, whatever it might be. So Sarah, do you mind focusing on that question for us?
Yeah, no, I think it's a really great question. And I think, I often find myself asking myself, restrictions are easing, people are returning to traveling and reuniting with family. And so many people are getting out and enjoying this mostly nice summer weather that we're having, so with everything improving, why do I feel so anxious? Like, what's wrong with me? And why am I having such a difficult time reacclimating to this normal life or the new normal? And so I think this is a great topic for us to be discussing this evening. And I think the answer is what we're experiencing, what we're all experiencing is normal and really to be expected after prolonged stress, uncertainty, loss, and isolation of the past year and a half. And so while it doesn't always feel great, a certain level of anxiety is actually a good thing. So I think when we're experiencing that, we need to remind ourselves, this is normal. There's some benefit to experiencing this anxiety. And I think reassuring ourselves can be a helpful first step in that. So a couple of reasons why anxiety is really important for us to pay attention to and can be really helpful and beneficial in our lives is that anxiety is designed to be a warning sign that we need to bring awareness to our current situation and maybe make some necessary changes in life. So if we're a little anxious about going back out, rejoining the exercise class, go grocery shopping, things like that, then, pay attention to that. Maybe you're more comfortable if you continue to wear a mask. Maybe there's some other things, smaller steps that you can take before you make that full step back out and rejoining the routine that we had been doing. Anxiety actually may help us feel more motivated, prepare us to face these challenges. So likewise, some degree of anxiety and those have a good working memory can actually help us enhance performance on cognitive tests as well, as lots of studies have shown. So, embrace that anxiety when we have it and use it to our benefit. But despite all of that, there are times where anxiety may be crossing over to unhealthy things and unhealthy ways of dealing. And I think a couple of things to pay attention to when it comes to that is if it's actually interfering with our ability to function. For example, are you finding yourself sleeping all the time? Or are you having a difficult time falling asleep in general? Is the anxiety interfering with your relationships? So for example, do you have a hard time leaving the house to meet a friend, to go out for lunch? Or really importantly, because I think a lot of us have really resorted to this during the pandemic, is do we find ourselves self-soothing? That's also referred to as self-medicating. So ways in which we can self-soothe or medicate ourselves in ways that aren't healthy in the long run, effective in the moment, but not healthy in the long run, is by having a drink or two or more. Sometimes it's through prescribed medications or taking a little bit more than prescribed. or food is a really big one that a lot of us turn to feel better. And there's other activities or substances that can really, in the moment, make us feel better, but after it wears off, or the next day, or days after that, it really has the counter effect than we really want it to. It really actually increases our anxiety. So there's a couple of, like two in particular, very important strategies I'd like to share to really help manage anxiety.
Sarah,
One
can I
is,
ask you to just try to speak up a
yep,
little bit more? I just want to make sure everybody can hear you because it's so important.
certainly. Thank you. I appreciate that. So I just said I wanted to focus on two very important strategies to help manage anxiety. One is baseline, establish or recommit to a routine of self-care. So that involves eating well and healthy, sleeping, exercising, and most importantly, I think it's really important to connect with others. And if you're not ready to leave the house or return to those, exercise classes, it might be phone calls, it might be text messages, it might be social media, but reconnect with people, stay connected. It's incredibly important. And if this feels impossible, set small goals and and work on them on a regular basis. The other incredibly important strategy is to stay present in the moment. I think we have a tendency to live in the past with regrets and should haves and would haves, but it causes a tremendous amount of distress with absolutely no positive benefit or possibility of change. So don't get caught up in that by wasting your time and energy in the past. Similarly, worrying in the future isn't helpful. So unless you have a crystal ball, don't spend too much time focusing out in the future. Stay in the moment, and by focusing on what you have control of, that will really help you stay grounded. It helps me stay grounded. These are things that I practice on a regular basis as well. So if you're starting to feel anxious, hit the pause button, take an inventory. Are you in the past? Are you too far out in the future? If you find that either one of those are the cases, I think it's helpful to bring yourself gently back to the present by taking an inventory. Start to focus on your breath, slowing it down, and then take a look around. What do you see? What do you smell? What can you touch? What can you hear? So it just kind of brings you back to the moment, hits the reset button, and allows you to move forward again and better manage your anxiety in a way that will help you function and bring joy back to your life.
Sarah, my gosh, that was so incredible for me. I think first and foremost, what you said about anxiety, I think thankfully as a society, we're getting more educated on anxiety and mental health and all of that. We have a long way to go. But there was a time when you would be embarrassed to say that I've got anxiety. I know I have anxiety, and I don't think I would say that out loud 5 years ago, and so I think it is so helpful to say, first of all, it's a normal, reaction, and especially with everything we've all been through. So I think that's something I hope it resonated with those of you that are listening, because that definitely resonated with me. I think the other thing that you pointed out, Sarah, which is, recognizing if that anxiety is being caused by something in the past or something in the future, and I think, unfortunately, the media can, really hurt us, and, focus on the Olympics, focus on something good, a comedy show. I made a commitment to myself not that long ago that I would stop watching as much news as I was. It was really bringing me down, because they talk a lot about the future. They don't know what's going to happen. None of us do. And then just setting the reset button, and what a beautiful time of year to set that reset button. I'm a gardener, going outside, getting your hands dirty. Even just if you're not a gardener, smelling the roses, or taking a ride to the beach if you're still afraid of being with others. But even, I travel sometimes for work, and if I get lonely, I get on Facebook and I see happy people and I see recipes and I see children and families. So there are wonderful ways. And I think you just really said it. So your voice, first of all, is the most calming voice I've ever heard. And I think we all need that acknowledgement that anxiety is not abnormal. It's actually very normal and very relevant. Alisa or Michelle, do you have anything to add to just kind of transitioning back to normal and overcoming the anxiety involved? No? Sarah, anything else to add to?
I think everything Sarah said.
Yeah. Perfect. Perfect. Okay, well, thank you, Sarah. That was wonderful. And I might call you once a week so I can hear your voice. Our next kind of question and subject that we wanted Michelle to talk about is solutions and support for unhealthy habits that were formed, in our senior population, which is what, we're focusing on seniors right now, but let's face it, we probably all had a little bit of this during a pandemic, and whether that unhealthy habit was drinking too much wine, whether it was not exercising enough, maybe it was even just staring at the TV for too long and not knowing to turn off CNN, or it could be smoking. So Michelle, would love to hear from you on just kind of advice that you have on that subject.
Sure, and thank you so much for having me as a guest today. I'm honored to be here and sharing along with these great panelists. I'm like you, I'm looking to get advice myself, so it never hurts. And Sarah has that voice. I love speaking with her myself. When we talk about how do we break bad habits, or how do we kind of get back to a place of healthy, I think the most important thing is really to know what your habits are, identifying exactly what those quote bad habits are, because not all are so obvious. And when you're in a rut, whether it's, as Sarah said, you're experiencing some anxiety, you have kind of fallen down what I call Alice's rabbit hole a little bit with COVID. We're kind of not in the norm, and we're trying to reintegrate back to the norm. And so we kind of have to separate out what is a bad habit by societal standards, I guess, and what is a bad habit that we recognize within ourselves. Habits are something we do so routinely and by rote. Brushing your teeth is a habit. Putting your shoes on in the morning is a habit. So you need to understand what your habits are and then separate out the good with the bad. And so we know that having, an occasional glass of wine, you might call it a habit to socially drink with your friends. And that might not be a bad thing, but it might become a bad thing when you get to a place where you find yourself drinking in excess or with more regularity than you used to, for example. So know your habits, know exactly what's good, what's bad, what you want to change, what you kind of know inside. This is not where I want to be. I want to kind of get back to normal, and I've gravitated away from that a little. So where am I now? I think the other thing is, so then once you identify that, I think you kind of look at things and say, okay, where do I go from here? How do I change this? I'm so used to doing this now. How do I get back to a place where I can undo something I've done? And really, as simple as it may sound, it is about making a plan. You need to make a plan. And I know I absolutely am guilty of this. People say, write things down, it helps. Sometimes I just go, okay, yep, write it down. That sounds logical. I do find when I write it down, whether it's a daily to-do list at work, whether it's a grocery list, right? We all know this. We don't forget when we write it down. When we go to the grocery store, 50-50 shot that you'll remember everything, but you might not. So writing it down kind of formulates your thoughts and centers them and says, okay, On paper, it's a plan. I think you also need to allow yourself the grace and the patience of breaking things down into smaller pieces. So your goal might be, my gosh, during COVID, I gained 30 pounds. What the heck? I feel out of control. What do I do now? How do I lose 30 pounds quick? It's a lot of stress on yourself to say this gigantic goal I need to achieve immediately. So you wrote down your plan. I'd like to get back to healthy. Maybe it's weight, maybe it's alcohol, maybe it's some of the things we spoke about. But the best way to do that is to break it down into smaller pieces. It's not about losing 30 pounds tomorrow. It's not about suddenly being a gym crazy, fitness person. It might not even about saying, it might be about saying, I must never drink again. For some, it might be, but in talking about breaking bad habits that you formed during COVID, it's about smaller chunks. So you may not be a gymnast suddenly, but you can do some lunges while you're waiting for your water to boil on the stove. Just if you boil water while your coffee's brewing, stretch your legs, move your body, make a point to walk around the table 4 times. That's it. The next day, walk around the table 4 times and clap your hands. The next day, walk around and raise them and sing. Those little things while you're waiting for your coffee to boil or you're waiting for your toast to toast gets you in a smaller mode of being able to move and to feel like you're contributing to your plan. You need to pick a trigger for your new practice. I just mentioned if your coffee's brewing. While you're brushing your teeth, stomp in place. Dun, 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 cleaning your dentures, brushing your teeth, brushing your hair, washing your face, singing out loud, believe it or not. People don't equate that with exercise, but you're exercising your lungs and you're giving yourself some motivation and you're feeling alive. Those are all tiny, small steps to get to where you want to be. After that, I think this is the most important part of breaking a bad habit and making new good ones. Find the pleasure in it. If it's all just about responsibility and I must do this, I must not weigh this, I must exercise, I must do, it doesn't feel very fun. Who wants to do that? Find the pleasure. If you're not a gym person and the thought of a treadmill doesn't excite you, but flowers do, take up gardening. That's exercise. It's the little things. Take a dance class. Again, dance around that table like nobody's watching and like everybody's watching, because it does help. Redesign your environment. You know what? We've been in COVID for a really long time. We've been in the 4 walls. The 4 walls get very old and ugly, really stale. So even in the action of changing your pillows on your couch, looking at pictures, take old pictures out of your picture frames, put new ones in. How does that equate to breaking a habit? It changes your attitude and your outlook about what you've just been in, including your environment, and brings you to a place that feels new. When you feel a little refreshed, you're ready to tackle some of those things that you need to do. Motivation alone is not enough. You have to feel that you're really wanting to create a plan to change where you are. I want to talk very briefly about the good habits and why they're important. We talked about the bad ones. Where do we want to go? There was a Harvard research study that suggested, well, actually it didn't suggest, it's a study, it determined that positive lifestyles in adults will increase a woman's life expectancy by 14 years and men's life expectancy by 12 years. Crazy. Maintaining 5 healthy habits will do this. The importance of these. What are the healthy habits what are the healthy things you want to do, and what do you want to avoid? Smoking is number one. We talked about ways in which to formulate a plan, but it's a habit that absolutely will contribute to a decrease in your life expectancy. We just went through COVID, and really, if we're being very blunt, mortality was on our minds. And so we don't want to be in a situation where the things we actually can control are the things that we worry about. Excessive alcohol consumption. The reason these are kind of common sense, but interestingly, excessive alcohol consumption can lead to memory loss and falls and fractures. Those are two things for the elder population that we really need to kind of focus on and increase our skills so that these things don't happen. Food choices are important. There's also what has developed during COVID. Besides the anxiety and mental issues, you have an overdependence on painkillers. That research is coming to the forefront. So people feeling, a need to self-medicate, self-regulate. Painkillers are something that we really need to, if that's one of your habits. I know that might not be a comfortable conversation, but you should have it with yourself and understand there are ways to kind of counter that dependence. Leading a sedentary life, which is really being lazy on our couches. Not our fault that we couldn't go out. You can now, and there are ways that we can make that happen. Take a dance class. If you're not an exercise buff, take a meditation class. Take a mindfulness class. I'm not promoting Cal, maybe I am, but we have mindfulness classes. It's a way to just kind of center yourself. Not being social will decrease your life expectancy. It's important. You're out of practice on socializing. We are really awkward right now at socializing. All of us, no matter what your age is, we need to practice it. It's like riding a bike. You do remember how to do it. You just have to get back on that bike. Sleep well, eat well, and understand that there are people and there are supports to help you reintegrate healthy lifestyles and eliminate the unhealthy lifestyles that we've all kind of been guilty of during COVID.
Wow, that was fabulous.
Thanks, Mel.
That was fabulous, Michelle. And I don't know if you saw me there. I was taking all sorts of notes. I think it's compelling to hear, what a positive lifestyle can do. The 14 years, the 12 years, just focusing on those 5 things. And I love the way you talked about, while the water is boiling, while the coffee is percolating, taking that, step around, walk around, do it and have fun, sing a song. I'm still singing a song. My daughter just got married last weekend, and I just still have the band in my head, and I haven't stopped smiling, and so, singing, dancing, those things, they're simple, and, you can do them by yourself and still have joy. So I love some of those examples, and it doesn't have to be in the gym to get the exercise. Stretching is wonderful. Stretching, right. we none of us stretch enough, right? And stretching and just even yoga, listening to, there's wonderful meditation apps that people can utilize on their phone. I download the Calm app, and it's wonderful. And so there's so many ways. But I think what you said about being out of practice, and certainly Cal offers that. And, I have had the pleasure of going to your center, and there's so many great things that happen there. And, certainly our seniors in Plymouth should be taking advantage of that, because being around people, finding joy, whether it's meditation, whether it's a fun, crazy event, it doesn't have to be totally social. It can just be whatever, and I know you offer a lot. So that was wonderful. Thank you, Michelle.
Thank you.
Sarah or Alisa,
Thank
anything
you.
to that?
I loved it. I liked the focus on doing something that brings you joy as opposed to feeling like you have to do it. And I think along those lines, there are many, many times where I am really well intended when I put my 2 feet on the floor for the day. I have a plan, I have a strategy, I have maybe even meal prepped on the good days. And then I fall off the wagon, and then I, veer, and then, the bag of chips is now gone. And, I think it's important to reset and to know that you might get off track at times, and that is okay. It's just really important to restart, reset, reground yourself, and don't give up. Readjust and continue on your way. So thank you.
Thank you. Thank you.
Wonderful.
And I would just add, I think, Michelle, you did a fabulous job and had so many great tips and tricks. And I think one thing to add is if people are feeling overwhelmed by falling off the wagon, or reach out for help. There are so many resources. That Cal's a great resource, but there's just so many resources that exist, and call and say, this is where I'm at and this is what I need. And you don't be afraid to advocate for yourself in that way.
Absolutely.
Great
Absolutely.
point.
Wonderful.
Great point.
So in kind of keeping on the theme of navigating, whether it's our anxiety or navigating maybe some unhealthy habits that we've formed, taking it step by step, our COVID introduced a lot of things to many of us. We're on one of them. We're on a Zoom webinar. I've never Zoomed so much in my entire life. In fact, I have to be honest, I'm not sure I ever Zoomed before COVID. That's the honest truth. I don't think I have. FaceTime was as far as I got, and I wasn't even good at that. So, many of us were introduced to so many new ways, and our seniors, if they didn't have an adult child around them or a grandchild around them, I can't imagine, because I am technically impaired, so I can't imagine what it was like. So Alisa's going to take on, how to navigate in our new world. How do we go about scheduling and working Zoom, telehealth, the delay of care that we've seen, all of those things. And also, if somebody is fearful of going to their physician in person, so Alisa, I'd love for you to take that and
Sure.
see what advice you can offer.
Sure. So I think a lot of what I'm about to talk about goes along with what Michelle and Sarah were discussing, because when we look at navigating kind of this new healthcare world, anxiety and a new normal come right into this as well. And Mel, you made a really great point. I remember when the pandemic first began, everyone was utilizing Zoom as kind of a way to socialize. In my family, we did an Easter egg hunt with my children, and my mom was watching, and all these really great ways that we used it. And now it's actually really kind of becoming more of a tool for us to navigate the world in general. So it's moved from being just the social aspect to kind of this is part of how we're navigating our daily lives, business, healthcare, yes, socializing at times. And I know that there's anxiety that goes along with it. I still, during many meetings at work, forget to take myself off of mute, which I'm sure a lot of people can relate to. Forget to, make sure my background's all set before I begin. So I think I'm just going to spend a few minutes kind of talking about how to prepare yourself if you are having telehealth visits, how to prepare yourself for that, and making sure that you're still getting your healthcare needs met, despite the fact that it may be happening via telehealth. So many doctors at this point are actually offering, depending on what type of visit it is, would you like a telehealth visit, or do you want to come in person? So I think the very first thing to do is to ensure that you're taking the type of visit that you're comfortable with to ensure that your healthcare needs are met. There are definitely some specialties and doctors that are still doing everything via telehealth, and some that have kind of transitioned back to most in person. So I think, you just have to be able to advocate for yourself. If you're comfortable doing a telehealth visit, you need to ask, are you offering telehealth? And is that an option for me? If you're more comfortable going into the doctor's office, you need to say, is it an option for me to come into the doctor's office? Because the very first step is to ensure that you're comfortable in the setting. Following that, if you are doing a telehealth visit, which I think a lot of people have actually started to appreciate, especially if they have some sort of chronic condition where they're seeing the doctor pretty frequently, that's managed really well, they're able to hop on every 3 to 6 months and kind of have the visit via telehealth. So some tips and tricks to prepare if telehealth is how you'll be conducting your visit. The first thing is you really should talk to your insurance company about coverage and co-pays. At this point, many insurance companies are continuing to pay for telehealth and have added telehealth as an option, but you just want to confirm that information. Some diagnoses are covered more than others under the telehealth umbrella. So if you have any questions, that's kind of the first step to make sure that your insurance company has the information. From there, you're going to want to prepare yourself electronically. So if you know that you're going to have a telehealth visit, get on beforehand, make sure, test your camera and test your microphone, and do all the things that will make you feel comfortable when you're going to have your visit. We, full disclosure for this webinar tonight, we all hopped on half an hour early to do just that. So it's important in any kind of setting that you do that, in any kind of tele setting that you do that to make sure that you're prepared. You're going to want to find a private place. Your healthcare is private information, and you want to ensure that you're protecting yourself in your home somewhere. These aren't types of visits that you should or want to be taking at a coffee shop or, out loud on your phone or anything like that. So find a place where you're in a private setting, put headphones in if you feel as though you don't want the information to be heard out loud. And then you'd want to write down your symptoms. So if you have any symptoms, make sure that they're written down and prepared so you don't forget anything. But many doctors nowadays will ask if you have something like a rash or something that's visible, that you take a picture if it's in a spot that can't be seen on video to share with the doctor beforehand or during the call. You'll want to make sure you have any medical devices that you have close at hand. Oftentimes, people are monitoring their own blood sugar, for example, or their own blood pressure, and they have those devices that they use at their home. So have those handy so you can take a reading while you're on the phone with the doctor or on your telehealth visit with your doctor. Write down your questions as you go along. So as you're, and this, some of these are really great just for in-person, just for doctor visits in general. But if you're doing a telehealth visit, write down your questions before and also while the doctor is speaking to you. Make sure that your devices are charged and ready for the visit so you don't get cut off in the middle. And then always be ready for a potential in-person follow-up appointment. The doctor may say, I think it's important that we see you in person following this. So just if that, make sure you have that in the front of mind as your visit's happening. If you know your vital signs prior to, if a lot of people have visiting nurses that come in or something along those lines, have that information ready for your appointment. And then I would also advise everyone to pick a spot with good lighting so that if there's anything that the doctor needs to see, you can show them, during the call. I think one of the only other things is if there are any caregivers that are on the call, or just if you have a caregiver, if they'll be doing the telemedicine visit as a caregiver for someone, make sure that the patient is nearby. We do understand in the telehealth world that there are patients that are, unable to kind of be present for a visit or maybe bedbound or something like that, but you want to make sure that they're close by so you can answer any questions from the doctor directly. And then finally, when the appointment ends, and this is true in any, again, telehealth or not, ask for a summary of your appointment. You always have the right to ask for a summary. And that will clarify important details that were given. And if they forget to provide a summary, you can always call and say, this is what or send a message that says, this is what I understood. Is this true? And that brings me to my very last point, which is to advocate for yourself. If you feel as though your health care needs are not being met via telehealth or in general, always be assertive You know, your health is more important than anything. So you should be assertive and own your own health journey and say, I'm uncomfortable with this. I don't think I got the information I needed. I need to have an in-person follow-up. Ask lots of questions, take lots of notes, and ensure that you're your best advocate.
Great advice, Alisa. Great advice. Michelle or Sarah, do you have anything to add to Alisa's conversation about kind of the navigating in our new world?
I just like to say, awesome job, Alisa. And I really like that you touched upon allowing yourself almost to have enough self-respect that when you're doing a telehealth visit, to really take the time and be private in your surroundings. Make sure you have quiet, because I think we're so focused on the technology component of it that we forget sometimes that we need to respect ourselves enough and give ourselves enough love and grace, if you will, so that to value those moments in time, whether they're on a computer screen or not. And I really like that you highlighted putting yourself first in that respect. So great job.
Right. So many of us don't put ourselves first, and we all need that reminder, Alisa. So that was excellent. So our last question, we're really all going to chat with you about, because I think this is something that we all saw, is how COVID-19 impacted those with cognitive impairment, those folks that might have had some dementia, a little bit of forgetfulness, maybe had Alzheimer's diagnoses, and what resources are there to help bring back joy and purpose? So, you know, I represent Northbridge companies, which we own Laurelwood at the Pinehills and Stafford Hill, both of which are in Plymouth. Northbridge has 18 communities altogether in Maine, in New Hampshire, Connecticut, and Massachusetts. Our focus is on the people. Our people are our residents, our associates, and our families, making sure that they are able to live life well and love life while living life well. So obviously we were all impacted by COVID-19, and we did have to ask our residents during a period of time to stay in their apartments. We had to close our dining rooms. We had to limit our programming. But, you know, again, back to the technology that we all were watching, and, you know, we couldn't go and visit the communities, but I was able to see via Facebook and videos what our teams were doing. And whether it was a strolling happy hour through the hallways, a hallway yoga class, associates dressing up in all sorts of different costumes to make our residents laugh. We made sure that our residents had interaction every single day, at least 3, 4, 5 times a day with people. We would teach them the technology, even if they couldn't do it, bring them an iPad so that they could see their family. What we saw when we started to reopen and open our doors throughout all of the Northbridge communities was folks coming to us who truly had declined, that the adult children were saying to us, my mother was not this forgetful when she, before COVID, but she literally sat and did nothing. She wasn't eating well. I don't know if she was taking her medications. And so whether it be an assisted living community or CAL going to a senior center, we're not the cure for Alzheimer's or dementia or anything like that. But these types of programs that Michelle spoke about at her center, the things that we do at a community like Laurelwood at the Pinehills and like Stafford Hill, maintaining independence but having people around, it certainly helps. And if a senior center or an assisted living community is not for you, for seniors in particular, you've got to find something, because they truly took the hardest hit of any of the age groups with COVID-19. They were isolated, they were lonely, and if they were living on their own in their own home, they were impacted, and it was really sad to see. So, if it's not a senior center, if it's not an assisted living, it's got to be some sort of a program. They've got to have those touch points with people, not be glued in front of CNN, finding laughter and joy. And, I'm going to turn it over to these esteemed panelists who I think will eloquently say it a lot better and give some advice and talk about the resources for those particularly hit cognitively throughout this pandemic. So I open it up to the three of you to chat a little bit. Sarah, you want to go first?
Yeah, really, Mel, I think you hit on the high points. I'm certainly from a hospital perspective, emergency room perspective, and the senior behavioral health unit, we saw a definite increase in people really struggling with cognitive decline, really accelerating, dementia and other challenges because of the lack of stimulation, the lack of interaction, the lack of connection. As humans, we are meant to be connected and to really stay involved. And I think also that connection and that interaction gives us purpose and meaning and identity. And being disconnected is really, really hard. I think it's hard on our soul, it's hard on our spirit. So I think engaging with, the activities that you described, that you did it at the assisted living programs and the memory care unit, and a lot of the programming that I know you have, Michelle, I mean, even I got those phone calls from the, Center for Healthy Living in Plymouth, and I felt connected, and it was exciting, and it was uplifting to stay connected. And I think it's just so important to do so. And I don't think it's too late to try to re-engage. So if you've had that time away, not as connected, or your loved one hasn't been as connected, I think it's really important to try to make those connections and the small steps back towards connecting. And maybe there's the connections and the activities are going to be different now than they were 2 years ago. And I think that's okay, but it's something, it's a starting point. It needs to happen, at some point. So I think it's just really, really important to reach out and to figure that out and make a plan and try new things to get reconnected.
Right. And Sarah, while I have you chatting, I know that there have been some questions on the chat just asking about, for that anxiety that folks might have, at what point is it not normal anxiety? At what point should somebody reach out for some professional help, and where do they go for that?
That's a really great question. I think when you're not able to meet your goals, to feel connected, to feel relaxed in your life, when you're having difficulty sleeping and eating and are really isolating, it's really important to reach out. Talk to your doctor. And that's a really great place to start. Alisa talked a lot about even reaching out via telehealth, and let them know what's going on. They're talking every day to people who are experiencing the same exact things that you are. They want to know if you're struggling. They care about you physically, mentally, emotionally, all of you. And and a lot of the doctors have resources. They have hopefully you have a good relationship with your primary care. They're trusted. It's a place to turn to, have those conversations and get connected with resources. They might refer you to a therapist or a psychiatrist, or, there's a lot of self-help out there that are really good and can be really helpful in terms of that social connection as well. Other people going through the same thing that you're experiencing.
Mm-hmm.
So it's
And
okay.
Yeah.
You deserve to feel better. There is help. There is treatment. There's no reason to suffer alone. Reach out.
Absolutely. Great. And Michelle, I know that, you talked about just some advice on if you had developed a bad habit, or, identifying those, writing it down. And if you can't work through it like that, and you're finding that habit got worse, I would imagine that the same advice would be to go to your physician. Is there any other advice that you would give to somebody?
Yeah, and I think, and Sarah hit on all of it, but I think it's worthy of just reiterating, a professional is a professional for a reason. That's what they know, that's what they do, and you should trust that the advice you're going to get from them is sound. At the same time, I think everyone on this panel has touched on this. I think being isolated makes people feel like they're the only ones that are feeling these feelings or feeling sad or unsure or worried or nervous, or maybe they think, maybe why am I so crazy about this whole situation? Why is it impacting me so much? It's really not just impacting you. If you find the courage and bridge the gap to reach out to a close friend, a loved one, and just say, I think I'm struggling here. I think you would be surprised maybe to find that the response will be, oh, I'm glad I'm not the only one. So there is comfort alone in just knowing that you are not an odd situation. You're not, an anomaly over here. You're not in the minority of feeling this way.
Right.
The good news about decompensation is the reverse of that is compensation. And Sarah said it, if you were functioning, if you have cognitive impairments and you were functioning fairly well pre-COVID, you have the ability to regain that if you are able to re-engage in what you did previously. So it is important that those connections happen. And it is important to know that you can get back what you feel you may have lost, just by simply not even doing new things per se, but just getting back to what you were doing prior to COVID. We know there's a direct correlation between physical health and mental health. We know there's a direct correlation between, as Sarah and Alisa and you, everyone said, humans were made to connect and interact. And if we're not doing that, all of us are losing something,
Right.
no matter your age or your ability. So
Right. I think I love what you just said, Michelle, about you can get it back. If you were at one level prior to COVID, again, COVID hit us all, and by getting back to some of that, some of the things that you once loved, kind of forcing yourself to do them, but taking advantage of the resources around you. And this, again, we forget, as humans, we do want to help each other. It's the one way we all feel great, when we help each other. So Alisa, anything that you would add to the cognitive impairment conversation in terms of getting back that joy, resources that are available?
Yeah, I think just to make the point that, and I think Sarah said it, you might have to find the things that you like, and it might be done in a different way. I actually think, and I've kind of framed this way in my personal life and when I, talk with others, that we have a unique opportunity because of the pandemic, that so many people and places and companies and artists and have been creative in how they now get their services out there. So there's new ways to do everything that wouldn't have existed, the beginning of March 2020. So I think if you love painting, go online and see if there's an online paint night. If you love nature, there's scavenger hunts, that exist online that you can go out and do a walk and then reconnect with the group. And so I think, it's hard because our livelihood a lot of times prior to this new normal was, for many of us, feeling connected in a social space, right? But our social spaces have just shifted, and it's just a matter of finding these really great opportunities that exist. There are book clubs online. There are so many things that are happening where you can still feel really connected to people, and be in your pajamas, which I guess can be a good thing for a lot of people too. So I would say, seize the opportunities that exist for finding joy maybe a little differently than you had to before.
Right, great. Well, I got to tell you, this was one of the fastest hours. Your conversation just flowed. I just want to, just remind folks that are on this webinar tonight that there are resources. If nothing else that you got from this, realize that you're not alone. If you have somebody in your life that is a senior that is struggling a little bit getting back to life as they once knew it, which was prior to COVID, there are so many resources out there. Alisa, who is at the Old Colony Elder Services, I know would be there to help. Of course, Michelle at Cal, which at the senior center here in Plymouth, right on the campus of the high school. And of course, Sarah and her wonderful work at Beth Israel Deaconess Hospital. And of course, if you have any interest in senior living, Janet Mahoney and the team at Laurelwood at the Pinehills or at Stafford Hill, both of which are great communities right here in Plymouth. There's always resources. You can walk in and just learn at any of these, at Cal, at Old Colony Elder Services. We're here to support you. We're not here to sell you. We're here to help you. And we're here to help you maneuver through finding that joy, that laughter, the friendship and family again. Because we're all going through it together. So on behalf of the Northbridge companies, I want to thank Michelle, Sarah, and Alisa for your participation tonight. It's been a true joy getting to know the three of you. And I will tell you, honestly, I got so many nuggets myself from this tonight. And of course, I want to thank Janet Mahoney also with Laurelwood at the Pinehills and Stafford Hill for all her support on this as well. So thank you all. If there are any questions at all, you can reach out to Janet Mahoney at Stafford Hill at Laurelwood. She can direct you to Sarah, Michelle, or Lisa if you have questions. But thank you all. Be well, stay well, smile, and dance around your counter tomorrow when you're making your coffee. All right. Thank you all.
Thank you,
Thank
everybody.
you so much. Thank you.
Good
Take
night.
care, everyone.
Thank you.